Caroline Jones.
Thank you for your statement, Cabinet Secretary. The past weekend highlighted just what amazing people we have working in our NHS and the wider health and social care sector. Doctors and nurses doing double shifts, GPs sleeping in their surgeries, staff walking miles in blizzard conditions, all to ensure that patients continue to receive world-class care despite sub-zero temperatures and snowdrifts. Therefore, I wish to place on record my thanks to all our NHS staff for the amazing job they do, day in, day out, whatever the conditions and the pressures they are put under. I may disagree with you from time to time on policy, but I will always stand shoulder to shoulder with you in defending our NHS staff. The only problem with our NHS workforce is there isn't enough of them. Cabinet Secretary, I welcome the additional investment your government has made in non-medical healthcare professionals and the increase in training places in Wales. However, there are increasing shortages in some areas of our NHS. As our NHS evolves, the staff requirements will change. So therefore, Cabinet Secretary, how will the LHBs and HEIW work together to take a more strategic approach to workforce planning in our NHS? Planning is essential to embrace the changes ahead. Will HEIW be undertaking an audit of staff within each speciality in order to address any shortfalls? When we look at diagnostic staff, Cancer Research UK tells us there is no data on vacancy levels within endoscopy. If we are to maximise the effect of the FIT test on bowel cancer, we must ensure that there are sufficient numbers of staff able to conduct colonoscopies. Cabinet Secretary, do you or HEIW have any plans to create a non-medical endoscopist training programme within NHS Wales? Of course, the majority of patient interaction within the NHS comes at the GP surgery, despite the fact that general practice receives just over 7% of the NHS budget. Cabinet Secretary, do you support the Royal College of GP's call to increase the spending on general practice to at least 11%? The Royal College have also stated that GP training places need to be around 200 per year. You have made progress in increasing the number of training places in recent years, but do you have any plans to increase this further? Finally, Cabinet Secretary, NHS England have announced a state-backed indemnity scheme for GPs over the border. So therefore, do you have any plans to introduce a similar scheme for Welsh GPs? As we celebrate the NHS's 70th birthday, it is important to highlight that it wouldn't exist without our excellent staff, and we must do all we can to show our staff, our NHS staff, how much we value them, both in monetary terms and also in terms of increasing staff. Diolch yn fawr. Thank you.
Thank you for the comments and questions. I'll start with your first point about we don't have enough staff. Well, we have record numbers of staff. We will always need to think about how we have those staff organised in the best way to deliver the best possible care. And regardless of the financial picture or otherwise, we always have a responsibility to do that. But we are 8 years into austerity. And the choices that we are making to put more money into the National Health Service come at a real cost to every other part of public services and public spending in Wales. If the Cabinet Secretary for Education were on her feet, she would tell you about real pressures. If the local government secretary were on his feet, he would tell you about pressures in those sectors as well and beyond. So let's not pretend this is simply a matter of political will. This is a matter of our budget is being reduced deliberately. People voted for a government that promised to impose austerity in 3 successive general elections. I wish they had not. But that is the choice that people made. And I really do think that people who have stood up and campaigned for a government to do that over 3 successive general elections need to take some responsibility in those parts of the country in Wales where they are now faced with having to make choices that are the direct consequence of the United Kingdom government austerity. On Health Education Improvement Wales, the point and the purpose of this is to improve strategic planning of the workforce. That's what they will do. As they move into the shadow reform for the shadow form for the first 6 months, I will have more to say specifically about this. So I'll, rather than talking off-piece now, I'll come back, I'm sure, in the future with more to say about them and their way of working. Just on your your point about non-medical endoscopists, we already have some within our system already. I've met a nurse endoscopist within Powys. I think it was actually in Russell George's constituency. But so those people do exist. Our challenge is how we have a route for them to continue to do that, as opposed to that person being a one-off. On your point about the percentage for primary care, I've stood on my feet in the chamber more than once in the past and talked about the percentage of NHS spend that goes into primary care. It's actually more than 11%. The regular response then back is from the Royal College of GPs. They're actually talking about the GMS side of it, so a specific part of primary care, not primary care in total. But you would have seen the ambitions that are set up by this government, but also within the parliamentary review, to have not just an increasing level of activity within local healthcare, but actually make sure that resources follow that, and we have a plan to deliver more resources in local healthcare where more activity will take place. And on your final point about GPs, I just want to go back to the points that I've made about where our workforce come from. Many of our GPs from the implementation of the National Health Service come from other parts of the world. Myself and many other people meet BAPTIO, the British Association of Physicians of Indian Origin, a huge part of the history of the National Health Service and of its future. And they too are concerned, as are all GPs, about indemnity. The state-backed scheme that was announced as a preferred option for the UK government in England is still something we don't have clarity on in terms of what it means and its application. And I say again, if there is to be a scheme that is negotiated with the British Medical Association and others to support GPs in England, and the UK government and the UK Treasury stand behind that, I would expect no less favourable terms to be made available to GPs in every other part of the United Kingdom. But those discussions are not complete. So I'm not in a business to tell you, because I know that a UK government minister is not in a business to tell anybody else. There's agreement on what that would look like, but there is recognition that indemnity is a real mischief for us to conquer.
Don.